So on the same topic, these are my disclosures. And as Dr. Altai already mentioned, CSCR is characterized by choroidal hyperpermeability, PED, and retinal neurosensory detachments. In most patients, there is spontaneous resolution, but in some patients, the disease becomes chronic with ensuing visual loss. And verteporfin PDT has been used to treat these eyes. However, PDT has some adverse effects, which include a transient reduction of macular function, RP atrophy, choroidal non-perfusion, and even secondary CNV. So in light of this, some colleagues from Taiwan decided to modify the normal PDT therapy, either using the half dose of verteporfin or the half fluence of the laser light for the treatment of these eyes. Despite these, they show that both of these protocols were effective in improving the best corrected visual acuity and eliminating subretinal fluid, but there was still choroidal hyperperfusion. So the purpose of our study was to compare the functional and anatomical outcomes of eyes with chronic CSCR treated with a yellow subthreshold laser versus half-dose PDT at 12 months of follow-up. So our study was a retrospective comparative study of 92 eyes treated with the yellow subthreshold laser and 67 eyes treated with half-dose PDT. And for the purpose of our study, chronic CSCR was defined as persistent subretinal fluid for 6 or more months. In terms of how we did the laser treatment, it was a subthreshold yellow laser with a duty cycle of 5%, pulse duration 200 milliseconds. This is very important, no spacing between burns. The spot size varied from 100 to 200 microns, and we did a power titration. And as you can see, there's a single spot under subliminal mode outside the arcades until you got a barely visible burn. Then we reduce it to 50% of the power. And these range from 320 milliwatts to 660 milliwatts. Unlike our colleagues from Germany, if the leak was inside the foveal area, we decided to treat the fovea as well. With PDT, it was 3 milligrams per meter square of Visidyne, 15-minute infusion, and the laser activation for 83 seconds. And the spot sizes range from 400 to 2,000 microns. The baseline characteristics you can see here under the subthreshold and the PDT groups were fairly evenly matched in terms of age, duration of symptoms, the mean central macular thickness, the mean subfoveal choroidal thickness, and the mean visual acuities. In terms of the results at 12 months, you can see that for the subthreshold laser group, we got a reduction in the central macular thickness, same thing as the PDT. In terms of the subfoveal choroidal thickness, there was more an effect with the PDT than with the subliminal laser. And in terms of the visual results, we were surprised to find that there was an improvement with the subthreshold laser, but not with the PDT group. If we look at the stratification of the visual acuities, you can see here the differences between the subthreshold yellow laser and the PDT. We had more patients in the subthreshold laser group having better gains and less loss compared to the photodynamic therapy group. You can see this here in the chart. This is the logmar. Let me remind you, the lower the logmar, the better the visual acuity. And you can see here with the PDT, it's pretty much we got stabilization of the visual acuity and not quite an improvement as seen with the subliminal laser. The anatomic outcomes were fairly matched between the two groups, as you can see here. And in terms of recurrences, we got about a quarter of our patients with the subthreshold laser needed more treatments with an average of 1.35 treatments with a range of 1 to 4. And the PDT, it was around 10% with less treatments than the yellow laser with an average of 1.2 treatments. The complications, we didn't get any complications with the yellow subliminal laser. However, in the PDT group, we got one eye that developed choroidal neovascularization that was treated with 3 intravitreal injections of bevacizumab. Here are some examples. This is an eye. You can see the ICG, the OCT, seeing the hyperpermeability. And this is the post-laser look at that eye with a visual improvement to 20/30. This is a case where, you can see the fluorescein and the ICG, and that was treated with the half-dose PDT. You can see the OCT, 2200. And then after the half-dose PDT, there was also an improvement to 2070. This was published recently in the BJO, so if you want to get more details, you can email me and I'll be happy to send you a reprint of the article. So comparing our work with other papers in the literature, from our colleagues here, Dr. Lihteh was a co-author of this paper. Again, they looked at 42 eyes treated with the yellow laser compared to 58 eyes treated with the half-dose PDT. And they mentioned that the yellow subthreshold laser was more effective in eliciting a response than the half-dose PDT. Again, the PLACE trial was already mentioned, and in the paper they wrote that it was high density, but as Victor mentioned, really it's hard to believe that there was really high density by the number of spots that he mentioned, and also because of the laser that they used was A10, and with the A10, as far as I know, they don't have like any patterns to really do invisible treatments in a high density. For me, that's kind of hard to understand that. So in conclusion, both half-dose PDT and the yellow subthreshold laser are effective in restoring the macular anatomy in eyes with chronic CSCR. However, it appears that yellow micropulse laser has a more beneficial effect in visual acuity than half-dose PDT. Thank you very much for your attention.